Hello, I'm Aurelio Mauro and I'm a gastroenterologist from the San Matteo Hospital Foundation in Pavia, Italy. On behalf of all the author of our paper, I would like to thank the editorial board of gastrointestinal endoscopy for having accepted the paper entitled Endoscopic Biliary Drainage in Patients with Surgical Altered Anatomy, the Street Multicenter Study. Well, first of all, we know that patients requiring biliary drainage in surgical altered anatomy are increasingly encountered in clinical practice. And especially, we know that patients with surgical altered anatomy are a very challenging scenario that could reduce the chance of technical and clinical success compared to patients with standard anatomy. We know that we are different endoscopic biliary drainage approaches available in our routine. However, their use is still not standardized in the practice. Moreover, in the clinical practice, we have new procedures that have been developed in the last year, such as the interventional EOS, that have been proposed also in patients with surgical altered anatomy. Therefore, the aim of our study was to explore the endoscopic biliary drainage approach in patients with surgical altered anatomy in different centers. We want to take such a shoot of what is now the approach in this category of very challenging patients. This was a retrospective multicenter study that was conducted within the IUS group. The iOS group is a network that was formed in Italy in 2019 to support an educational program aimed at improving interventional video pancreatic procedure. And come to our study, this was a retrospective study, and a total of 432 patients were included. All these patients were divided according to their surgical altered anatomy. In particular, we divided patients in three major categories of surgical altered anatomy: the BIRO 2, the pancreatoduodenectomy, and the Roux-en-Y reconstruction. Patients come from different centers, 21, and were enrolled from 2018 and 2023. Coming to the major results of our studies, we explored how the different endoscopic biliary drainage approaches varied among the years, and we found that some procedures, such as the device assisted enteroscopy ERCP, was more frequently used in the first years, whereas such procedures such as the interventional endoscopic ultrasound was performed more frequently in the last years. Moreover, in the Sankey diagram that is shown on the right, it is very interesting that one procedure does not fit for all the different type of indication and reconstruction. And this is well explained by these figures. Coming to the major outcomes of our studies, both technical and clinical success of the endoscopic biliary drainage was around 80%, and globally the rate of adverse events were around 10%. When we compared the patients with benign and malignant indications, we did not find any differences among the outcomes. However, when we compared the outcomes among the different type of biliary drainage approaches, at the multivariate analysis, a very interesting result of the study was that interventional endoscopic ultrasound was the only predictor of clinical success, with an odds ratio of 7.87. Moreover, we perform other analyses between the different type of endoscopic biliary drainage approaches, and compared to the different type of surgical reconstruction. And it was very interesting to find that the higher rate of adverse events were noted in patients with birth to the reconstruction, with a rate of adverse events around 15.3%. Moreover, we performed some sub-analysis comparing the outcomes among patients with native papilla and patients with hepatico-jejunal anastomosis. And as expected, the higher rate of adverse events were found in patients with native papilla. Moreover, here in this table, you can find also the different type of interventional endoscopic ultrasound procedure that were applied according to the indication of biliary drainage, benign or malignant. In conclusion, the biliary drainage in patients with surgical altered anatomy is still associated with a suboptimal chance of success in all the different types of reconstruction. However, the increasing use of interventional EUS procedure in the last years significantly improved outcomes in patients with surgical and altered anatomy treated with these techniques. Further randomized control trials obviously are necessary to evaluate which is the best endoscopic technique in the most challenging uh, reconstruction, such as the Roux-en-Y. And again, I want to thank gastrointestinal endoscopy for the opportunity of presenting this video.